When we're looking to see if a person has any alignment or motion issues, going on in the upper part of their neck, there's a very interesting side effect, almost, if you would, in terms of one of the things that we see going on that relates to people, particularly women, but also men, when they are carrying their children. So what typically happens is if you've got a misalignment, in the upper part of your neck here, your brain's not going to quite work right if that thing is not properly supported. And so what happens is that it causes, as it shifts, let's say for the sake of argument, it shifts this way, that as it goes like that, your body's going to produce a compensation, something along these lines like that, or your shoulder's going to drop on the opposite side. And a consequence is that your weight is also going to shift towards that same side. And this is what we talk about as being a normal compensated pattern. I say this all the time, is that posture is not a reflection of laziness. It's a reflection instead of the ways that the intelligence of your body is trying to compensate to keep everything working as well as it can. And as a general rule, and there's more to it than that, but people, depending on the nature and the configuration of what they have going on in the upper part of the neck, they've got a stable side and then they have an unstable side. By stable side, I mean that they're able to do all of their day-to-day kinds of things and it doesn't really cause them any issues. By unstable, I mean that they're more likely to experience joint pain, muscle pain, issues, breakdown in their body, because the way that they are using their body is actually the exact opposite in terms of how their body's trying to compensate for this. So what does this mean in terms of people when they are carrying their children? Well, yes, we would think and we would like to know that when we are holding our children, that we're always in this nice upright position and they're not going to be squirming or anything along those lines, or that you can have a pack in the front or a pack from behind and you're going to be in this upright position. But the reality is, for anybody who's been a parent for, more than a few minutes here, there comes the point where you just become more comfortable, slinging your child, holding them on the hip, especially if you're trying to have a grown-up conversation and get some other stuff done using your opposite hand. So here's the important thing and what it means. It means that if you swing your weight onto one hip, so say over like this, towards this side here, that if that is towards the stable side, then you're actually going to be able to function. You're going to be able to do that, no problem. But if you actually don't know what's going on up through here and the way that your body needs to compensate for your center of gravity, if you, out of comfort, habit, or whatever reason, because you're right hand dominant, left hand dominant, shift your hip towards the opposite side, causing everything to basically kink and collapse like that, especially if it's a young mom whose body is still trying to heal from pregnancy itself, where all of the ligaments, especially those in the pelvis, have been made stretchier for a bit, that if you're going in that wrong direction and you don't even know it, then what's more likely to happen is you're far more likely to start to experience issues with your hips, issues with your lower back, issues with your shoulders, issues with your neck, and you're going to attribute it to stress or maybe different things associated with the pregnancy. And yes, it's really good. It's important to, get any of those issues in terms of treatment for your lower back, treatment for your shoulder, or wherever it might be going on. But the point here that I'm wanting to show out, it's also really important to know what your center of gravity up through here is and what that means in terms of how you should or shouldn't be actually using your body. Because again, ideally, we're always standing up straight like that. But the reality is, when we're dealing with children, is that we sometimes have to do whatever we need to do. So by simply ingraining the habit and identifying, okay, this is what is going on in your individual body, and then let's tailor your daily activities so that you're playing to your strength and your stability rather than accidentally leaning into your weakness. You're going to be far more likely to be able to do all of those day-to-day kinds of things that you need, that you want to, so that you can be, enjoying all the things that you want to in life without then, having to go and take some downtime to try to repair something all the while there.